In today's video, we will be demonstrating 3 techniques that can be used to help assist an individual with a cough. This video is for informational purposes only and isn't a substitute for medical advice or diagnosis. These techniques are commonly performed on individuals who have neuromuscular conditions associated with low tone, paralysis, or weak abdominal musculature needed to perform a forceful cough. All of today's techniques will be performed in supine for demonstration purposes. Before beginning each technique, you should listen to the individual's lungs using your stethoscope, noting abnormal lung sounds such as changes in pitch or crackles.
All right, we're going to be teaching the patient the Costophrenic assist. So I'm just going to put my hands on your ribs, and I have my hands on these Costophrenic angles, and I'm going to have you breathe normally into my hands. I'm going to help you push the air out. Good, and then breathe in, and I'm providing quick stretches down. And then I want you to hold your breath at the top and turn your head to the left and cough.
I'm going to demonstrate the Heimlich-Type assist. You're going to breathe in deeply, and at the end of your breath, I'm going to push up and in on your diaphragm, and then you're going to cough. Okay, so breathe into my hand. Normal breaths. Take one more. Okay, now take a deep breath in. Push up and in, cough.
Alright, today we're going to be teaching Brandon how to do the anterior chest compression facilitation maneuver to help assist him with coughing. Alright Brandon, so I'm going to have one arm placed here on your upper chest, and this is going to help facilitate your cough. One arm placed down here on your diaphragm to help block it, okay? So now I want you just to breathe in normally. Good. Alright, so breathe in normally into my hand. Now breathe all the air out. Exhale. Now breathe in deep. Look to your left. Hold your breath. Cough.